what triggers the release of hydrochloric acid to mix with the pepsinogen to become pepsin to get ready for that chiming kind of process. The trigger is appetite. Okay? So if you smell food, if you anticipate food, you get hungry, now the hydrochloric acid is triggered to be released from the mucosa and does that mixture. It's called the digestive cascade. Doesn't that sound romantic? The digestive cascade occurs. So in preparation, when we smell food and we get hungry and we're anticipating, the digestive cascade occurs. And it quickly moves from 3.5 down to 1.5 in preparation for that bolus that it knows it's getting. The body is an absolutely miraculous thing. It really is. It never ceases to amaze me how these things will occur. All right, so what happens if you don't have a sense of smell and your appetite does not get triggered? None of this occurs. That's where you're like not hungry. Without acid, the stomach, this area cannot break down the bolus into chyme. And that's where you have a gastric emptying problem, because the pyloric valve will not be triggered to open and relax, allowing that to come in. So gastric emptying problems are common with our patients that are getting elder and having low appetite issues. It's because of this lack of smell, lack of taste capacity. And it's also caused by long-term use of PPI medication, which prevents the release of acid. You don't have the release of acid, you can't mix it with pepsinogen, and you don't get pepsin, and you then have partial foodstuffs sitting in your stomach, and you have a gastric emptying problem. This is one of the main problems that cause a patient to lose weight involuntarily. So gastric emptying problems are a perfect physiologic setup for gastric atrophy. When you have gastric atrophy, that is a precursor to stomach and pancreatic cancer. So now you can have a better understanding of how we get stomach and pancreatic cancer. This is why. This is the cause. It starts with gastric emptying issues because we're not getting that pepsin to function or to be developed properly.